Hey guys, it's Miss Reyes and Miss Ratcliffe, and we're here. We're going to be talking about central line care and the dressing change. The first thing that we're going to be doing is we're going to be looking at assessing and removing the dressing. So we're going to introduce ourselves to the patient, perform hand hygiene, and we're going to verify our patient's identity using two different identifiers, as well as verifying our patient's allergies. We're going to explain the procedure to the patient, and then we're going to gather all of our equipment.
Okay, so I have my central line dressing change kit here. They're all gonna look different. This one has like a sterile drape that's around it. Some of them don't, so it will depend on which one you have in your skills kit. You need to make sure you look at this and see that there's no rips or tears in it. It's not expired, it's not discolored, and mine looks good. For the upward mobility skill, you also are going to need a flush, a cap, and some alcohol. And you may need some masks. So usually your central line dressing change kit has a mask in it. We will have masks available for you in the lab, but I like to grab two and go ahead and put those on me and the patient before I open up my kit. Okay, and some clean gloves.
Okay, so at this point, we're going to assist the patient to a comfortable position, which is going to be either semi-Fowler's or supine, and we're going to expose the catheter insertion site while maintaining privacy.
Okay, so I have raised my bed to a good working height, and I've also sat my patient up. I am going to go ahead and expose this central line. You want to make sure that you provide privacy for your patient, but the most important thing here is that we're giving yourself enough area to where we're not going to break sterility. Okay.
Okay, so at this point, we're going to don clean gloves and a mask.
Mask on first.
Then we're going to apply the face mask to the client and have the client turn their head away from the central line site.
Okay, so what is the rationale for why I have a mask on and why my patient has a mask on? Because they're probably gonna want to know why they have to put a mask on. I want y'all to think about that for a second. The head doesn't really turn on this guy, so we're just gonna keep it like that. But we're about to open up this dressing to air, and underneath here is a central line. This line goes right next to the heart, so it's very high risk for a bloodstream infection. So that is why we don't want our patient breathing on this, and I also don't want to be breathing on this. So we're trying to minimize as much exposure as possible. The next thing I want to tell you is I'm going to go ahead and take off my lab coat to make sure that I don't have it in my way when I'm doing my sterile procedure.
Okay, so now that she has her mask on her patient, she turned her patient's head away, she's going to assess and palpate the central line insertion site while she notes the type of catheter line that's in place. Once she does that, she's going to carefully begin removing the existing dressing and any stabilization device or tape, and she's going to discard of it.
Okay, we're going to use the push-pull method to try to prevent injury to the skin. And while we're doing this, we're continuing to assess that central line dressing area for any redness or drainage or anything like that. So you're going to pull that dressing away, and you're going to pull it away, and you're going to try to get all of the dressing off right up to that insertion site. But remember, we don't want to touch our fingers on that insertion site. On the bare skin, like I'm touching my fingers on the dressing, but on the bare skin. And then you can go ahead and remove it.
Okay, so she's going to inspect the catheter, the insertion site, and the surrounding skin visually. So she's doing that. She's going to remove those soiled gloves and then perform hand hygiene. Okay, so now this is the part where we're going to be applying the sterile dressing. Okay, so now she's going to apply her sterile dressing. So she's going to be opening the dressing change kit, using care to maintain sterility on the bedside table.
Okay, I'm gonna go ahead and move these gloves out of my way because I don't need them right now. Once you have taken the dressing off of your patient, it's very important that you get the other dressing on pretty quick. Okay. So you see that this has a sterile field in it, so I'm gonna go ahead and throw this away. So my kit has a mask in it, but I don't need it because me and my patient both already have one. Again, we're being very intentional with our fingers, where our fingers are going and what our fingers are touching. So I have a nice open area here. Now I have to go in and get my gloves. You can grab it with the drape. That is one method. I prefer to just grab it out of the sterile area, but I'm going to be very careful again with my hands and where I put them. I like to rough them up a little bit. Being very careful not to overlay my gloves over my field. And I'm also visually looking at everything right now, okay? So I'm gonna grab that cuff, step back, hand down, pulling with this hand right here, getting that glove on, okay? Then we're gonna go in for the scoop. Get your fingers deep into that cuff and hitchhike that thumb. Step back again, pushing that glove onto that hand, okay? So now we're sterile. I call this surgeon hand. So we're gonna keep our hands up high. We're also gonna be very intentional with all the things we're touching. Only touching things that are sterile, okay? All right, so I'm gonna go ahead and look at my kit, see the things that I have. I have an alcohol swab. I have a Q-tip, some tape, some gauze, and I have a chlorhexidine. So right now I'm gonna grab my chlorhexidine. I don't think I need any extra gauze or anything to wipe anything off. There's not any additional drainage, so I'm just gonna go ahead and clean with this. So we're gonna break it. What I like to do is kind of get it started on my glove. That's just something I've always done. Now we're gonna use this and we're gonna start at the insertion site and we're gonna vigorously scrub out from there. And we're gonna try to cover everything that dressing is going to be on. So anything that's going to be under the dressing needs to be cleaned, including the lines, okay? Okay, so we're gonna go ahead and start cleaning at the insertion site. Again, it is a vigorous scrubbing motion. Vigorous, okay? We're going to pretend like this is sutured in, okay? I know it's not, but it has spots for sutures. And I'm gonna just scrub all over that line. You can even go under. And look, at this point, I have not dirtied up any of my hands. Now, if you look, I've scrubbed well beyond where that dressing's gonna be to make sure that everything underneath there has been cleaned very, very well. Okay, so I'm done with this. I'm gonna set that there.
Okay, so now she is going to allow that antiseptic to dry completely, and then she's going to apply skin prep if it's indicated. If she needs to secure the central line with an appropriate stabilization device, she will.
Okay, so for this one, it is sutured in, so we don't have a stabilization device, but what most sprays is talking about is like a stat lock, so you'll see those on your PICC lines.
Okay. And so now at this point of the skill, she's going to go and apply the transparent dressing.
Okay. All right, so I've got my dressing. Okay, so one thing that's super important on this dressing is we're gonna try to get the insertion site as close to the middle as possible. So we've got a lot of area before we get open to air, okay? Go ahead and pull this off. Okay, so now I'm gonna go ahead and apply my dressing. If you look right here, you can see that where my fingers are, that's actually not where the dressing is, so that's a good place to hold it. So we're gonna try to get it right the center at the insertion site. And really try to make sure you push it down good. There you go. And you can see I'm going around and really adhering it to the skin as I remove this paper. So most facilities will have an additional dressing to reinforce it right here, because your patient, you're going to have a lot of pulling on this area right here, so just be mindful of that. So you see, we want to make sure this dressing is sealed down all the way around that central line, and we're also going to put our name for our initials, time and date, and we're going to put it on here, but you can see it'll attach to our mannequins, so we're going to not do this for our mannequins. Okay, so that is all you have to do for your central line dressing change. So now we're gonna move into, well, you need to document. So now we're gonna move into the cap changing skill for upward mobility. Okay, so now we're gonna go ahead and change a cap on our central line. Now when you are doing a dressing change, usually this is every 5 to 7 days per facility policy, but I think most places do every 7 days. And just for your ability to hear me, I'm gonna remove my mask. So we're gonna pretend like I kept it on, but it's like fogging up my glasses and y'all can't hear me. So we're gonna pretend like I didn't do that. Okay, so you wanna make sure that every time you do a dressing change, if it's that weekly dressing change, that you're changing these caps right here, okay? So these will be changed. Now, if you look at the central line I chose, they have different caps. So this cap looks different than this one. So you may have different ones depending on the facility that you work at.
Okay, so the first thing that she's going to do is she's going to prime the new cap with normal saline.
So I've got my supplies right here. I'm gonna keep my sterile gloves on because they were sterile, now they're clean, so it works great. I don't need this, I'm gonna throw this away. Okay, and I'm just using this because it's clean and it's already here. Okay, so we're gonna prime our cap. Anytime we have a saline, we're gonna get our bubble out. Okay, got my bubble out. Now I like to open this to where I can prime it and keep it in the package. It's kind of hard to get it from this side. I'm not gonna be able to get it. So there are two ends to this. I'm gonna go ahead and take it out to show you. So this end right here is the one you're priming because this is the one you flush with. This end actually goes on the catheter. So which end do we need to hook our saline up to? This one, right? Okay. So now that I've kept my package okay, I'm gonna prime it real fast. See our little bubble coming out? And I'm gonna just stick it right back in here until I'm ready. Put it up here on my patient.
Okay, now she's going to clamp the catheter line and remove the injection cap.
So it's very important that we clamp the line, because if the line is unclamped and we take this cap off, we could either be introducing air or we could be allowing blood to come out of this line. So make sure all your lines are clamped. So all my lines are clamped. And I'm gonna go ahead and do this white one right here, and for skills, you're gonna be only changing one cap, but in practice, you'll be changing all your caps. So, all right, so I'm gonna go ahead and remove this cap. Again, I'm being very careful not to touch my fingers over this. Okay, so now I'm gonna take my alcohol. I got one of the big alcohol swabs because I like them better. You'll probably have a small one. So I'm gonna take it, wrap it around this cap like a baby, and I'm gonna scrub vigorously. I think your skill sheet says
15 to 20 seconds.
15 to 20 seconds. And again, 15 to 20 seconds is a lot longer than you think, but for video purposes, I'm not gonna scrub it for 10 to 15 or 15 to 20 seconds.
And again, just note that she's not touching the open hub at all. And she's going to allow it to dry.
And I'm still holding on to it because if I put it down, now we're contaminating it. So I'm holding it. So while I'm letting this dry, I'm gonna go ahead and get my saline ready. Now I've got a cap on here, so I have to take this off. I have to hold this, and I have to hold the cap I just cleaned. So I'm gonna use my fingers over here, and I'm gonna go ahead and gently take this cap off. Now I'm gonna connect, making sure that I hit the connections just right so I'm not contaminating. Okay, so they are connected. I'm gonna go ahead and really make sure that they're connected good. And now that aseptic piece is out of the way. So I'm gonna go ahead and unclamp my line. And I'm gonna check for blood return. This guy doesn't have a bloodstream, so we're not gonna get blood return. Check for blood return, and then I'm going to flush. And when you flush, you're gonna be doing a pulse pause method to flush that line out. And we're gonna flush with the full 10. Okay, and depending on your central, you may have to clamp with positive pressure, so this one you don't have to. All right, and that is it. So we're gonna take this off, and we would change all the caps. Now I did want to talk to you about this. This little cap right here is an alcohol infused cap you may see in facilities to cover up these caps. And I have some orange ones here, this one's green. So this is not required for this central line. These clear caps have to be on there, okay? These are preventing bacteria from going in or blood from coming out or air or anything. Those have to be on there. These are just alcohol infused caps that cover the cap to protect it. So I'm gonna put one of those on. So I'd like to go ahead and get it ready. And again, I'm not digging my fingers all down in it, okay? So I'm taking it off. And we're just gonna take our saline off, and we're gonna put this cap on. Okay. All right, so that is the central line dressing change skill. I want y'all to remember to make sure you are sterile with this. Super, super important to protect our patients from bloodstream infections. If y'all have any questions, let us know.